Bacterial meningitis. The causative agent for bacterial meningitis is bacterium, in which there are several pathogens and strains of the disease. Some of the leading causes of bacterial meningitis in the United States include Haemophilus influenzae, most often caused by type B HIV, Streptococcus pneumoniae, group B Streptococcus, Listeria mitocytogenes, and Neisseria meningitis. These bacterium travel from person to person in droplets of air in the air as they cannot move independently.
A meningitis epidemic can break out anywhere in the world at any time. However, the disease is most common in the sub-Saharan region of Africa during the months of June through December. The disease is not very present in our society, and in non-invasive areas, there are only about 0.5 to 10 cases for every 100,000 people. In epidemic areas, this number rises to about 1,000 cases for every 100,000 people. The global mortality rate of this disease is 14.4%. In Africa, the mortality rate is higher at about 31.3%. This is because the higher contraction rates and the fact that many African countries lack the resources to effectively treat infected peoples. Meningitis only affects humans, and there is no animal reservoir. Fortunately, the bacteria that carries meningitis is much less contagious than that of the common cold. The bacteria are carried in saliva and mucus. Modes of transmission include kissing, sneezing, and any other bodily act that can transfer mucus or saliva from one human to another.
Meningitis inflames the meninges, a thin membrane around the brain and spinal cord. This membrane is composed of 3 layers: the dura, which is the toughest outermost layer and is closely attached to the inside of the skull. The middle layer, or the arachnoid, is important in the normal flow of cerebrospinal fluid, CSF, a lubricating fluid that bathes both the brain and the spinal cord. And finally, the innermost layer, the pia, helps direct blood vessels into the brain. The infectious bacteria can directly damage brain tissue, but usually harm is caused from the swelling of the brain as a result of an inflammatory response. This quickly causes compression of the brain against the bony skull, which interrupts the normal absorption of CSF by blood vessels. This leads to an accumulation of CSF and an increase of pressure on the brain, thus leading to unregulated brain activity. Long-term effects can include hearing loss, brain damage, paralysis, and learning disabilities. Immediate symptoms include fever, headache, vomiting, photophobia, irritability, rash, lethargy, and stiff neck. And later, if not treated, come seizures, confusion, and eventually coma or death. About 24% of bacterial meningitis patients will have acute meningitis and present symptoms within 24 hours, and the damage will progress quickly if not treated. If the pathogen is not treated, the bacteria can cause extensive brain and nerve damage within days. When a foreign bacterium is present, our body responds by increasing local blood flow, thus causing inflammation, in order to slow the reaction by separating the harmful organism from the body's tissues and cells. Our complement system, comprised of proteins, serves as the alarm for the rest of the immune system. In cell-mediated immune responses, activated cytotoxic T cells, or killer T cells, can directly fight a foreign antigen that is presented to them on the surface of the bacteria. The T cell might kill the bacteria before it has a chance to replicate. Also, the T cells produce signal molecules, or cytokines, that activate macrophages to destroy the invading microbes by phagocytosis.
Treatments do exist for bacterial meningitis. Antibiotics can be very useful in fighting the bacterial infection because they poke holes in the bacteria so that they go through apoptosis. Other treatments for meningitis involve decreasing inflammation with steroid preparations and paying careful attention to the balance of fluids, glucose, sodium, potassium, oxygen, and carbon dioxide in the patient's system. Basic prevention would include no physical contact with someone who has contracted the disease. In developing countries, vaccines are readily available, and some are even required. The HIV vaccine has almost completely demolished HIV. The pneumococcal polysaccharide vaccine uses inactivated bacteria to train the body's own immune system to fight live pneumococcal bacteria. Finally, the meningococcal vaccine helps the body develop antibodies to the sugar that coat the meningococcal bacteria. The vaccine teaches the immune system how to break through the bacterium's armor. Once the immune system has cracked the shell, the bacterium is powerless.
Common public health implications surrounding meningitis, among other diseases, include historical issues that can be well translated into modern day. Access to proper care is an ongoing issue worldwide, whether it be lack of technology, knowledge on the disease, or an access to vaccinations and antibiotics. The lack of these preventative measures may cause an outbreak of meningitis in an area that is not prepared to handle it. In order to hinder the spread of a disease, vaccination requirements could be implemented in order to prevent epidemics of the disease. Although the vaccinations currently available do not protect against all forms of meningitis, in 2010, public health officials announced measurable drops in global meningitis cases following the introduction of low-cost vaccines, offering broader protection. Low-cost vaccinations open doors for impoverished areas where they may be an easy target if not for vaccinations and antibiotics.
PSA, don't be a sucker. Think before you pucker. Have you gotten your meningitis vaccine?